Exactly 35 years ago, Mr. Olayinka and Mrs. Sherifat Balogun welcomed a bundle of joy in the person of Dr. Kafayah Ogunsola in Enugu State, Nigeria. She attended Air Force Nursery and Primary School, Enugu. Few years later, her family relocated to Lagos, where she got her secondary education.
I was born into the family of Mr. Olayinka Balogun and Sherifa Olabisi 35 years ago. That was in Enugu, where my father was starting his career in the police force. And thereafter, we relocated to Lagos. My primary school was in Enugu, Air Force Nursery and Primary School. Growing up in Enugu was interesting. My father was the PRO of the police command then. And I remember that we used to have this house on Abakpa Junction. It was adjacent to the 82 division of the military. So we had a lot of military men, patrolling, even though we're a police family, but it was also, we had so many military men around us, soldiers around us. The house was in its own way isolated. So it was myself, my older sister, my dad, and my mom. My dad was very strict, Our Arabic studies was very important. So whenever we heard his car coming in, you see us running to go and get, our Arabic books because that's the next thing. He knows we will have gone to school, so in the evening you had to be looking at, reading your KU and all of that. And the moment we picked the book, I remember that we just fall asleep on the couch, and my dad would say something like, "Look at them. It's when you are reading this that you'll be sleeping. If you were playing, you would not be sleeping." It was interesting, but it was a happy childhood by and large.
Distinguished Dr. Kafayat was opportuned to attend 2 secondary schools. First was Lagos State Model College, Mirror, and was later transferred to the prestigious Queen's College, Yaba, at GSS2. With the influence of her mother, who works with the Lagos State Ministry of Education, she rounded off her secondary school education in 2001 and proceeded to the University of Ilorin to study medicine and surgery.
I transferred from Lagos State Model College, Mero. My mom and him decided at some point that I should leave Mero and I should come to QC. Currently, mommy works with the Ministry of Education, so she was able to help me facilitate the transfer. And I rounded up there, in 2001. It was interesting. I was the food prefect for Obi House. It was just, regular time in school. We had fun. We made lifelong friendships and relationships. Nothing out of the blue. I wasn't a troublesome child. Somehow I was able to just keep my head on, even when I went to learn, when I went to university, I was away from the house. But, alhamdulillah, things was just, it was fine,
Dr. Kafayat grew up with her elder sister and parents. Her father was a PRO of the police command, Enugu. Hence, he was a disciplinarian. She let us know that her father, being a devoted Muslim, was strict with their Arabic studies.
He was strict in the positive light, if I would say. And I think that him being that strict and that disciplined actually shaped my life. I knew that there were no chances. I couldn't mess up. I knew that he wouldn't cut me slacks for things like that. And I didn't grow up like a rigid child. I didn't grow up not exploring and not having time to be adventurous and live like an adolescent. But I was just mindful of the environment I came from. I was mindful of who my father was. And, when he joined the police as, a cadet ASP, because when you're a graduate, you join as a cadet ASP. I gave him leverage, you don't have to join as the rank and file. And then he continued to grow in rank in the police force.
Amiable Dr. Kafayat lost her biological mother to breast cancer at the age of 7. Through faith and courage, they moved on with their lives. After the bereavement of their mother, and found a woman that was a mother to her and her siblings.
I lost my mom sometime in 1990. I was 7 years to breast cancer. It was a stressful and traumatic period in our lives, but somehow, we rose over it. She had 3 of us. My last sister was 2 years when that happened, and but my father was he was strong. In faith, in socially, morally, and in physically. So somehow he was able to steer the ship. And then he got married to my stepmom, who everybody knows now, Alaja Risikat Balogun. And then she's also been our pillar. We have a very fantastic relationship. If you see us now, you wouldn't actually believe that she didn't have us. Luckily, she was, way older when my dad married her. So she fit in the mother figure for us, and then she came in and gave us our 2 younger brothers. You wouldn't know that we were not from the same mother. That's the truth.
Eloquent Dr. Kafayat narrates how her father's disciplinary attitude shaped her life to who she has become, and his personality has inspired her quest for success. She attested that her father is a role model and his impact in her life is invaluable. Her father contributed to her passion and decision to become a psychiatrist. Moreover, her father's reputation inspired her to strive for excellence as an individual.
All the things I heard about my father and the accolades that he's gotten here and there has also shaped me for who I am. You know, it's always been in the positive light. On my 10th birthday, and I still have the pictures of it, and my father also has it displayed in his office, I was dressed as a doctor. I remember then he was in Aba. I don't remember the Eziama, I think, police station in Aba. He got me the doctor's outfit and the stethoscope, and that was my 10th birthday. So it was, it was framed. So I guess that was the beginning of my interest in medicine. But the one of the singularly most important validation I needed was actually from my dad. And when I told him I was going to do psychiatry, the man said, a doctor has to take care of them. That was all I needed. I tell you, that was all I needed. Once my father said that, because he plays a very important role in my life. I mean, I look at the man and he's actually my role model. There's no other person that trumps him in my life, you know. So once he just said that, I said, that's all. And, you know, I went ahead for it.
Dr. Kafayat reminisced that her mother never indulged her and her siblings from their father's disciplinary means. Her father's occupation did not give room for juvenile pranks.
We had to take care of our books. You know, our books are very important to him. Books were very important to him. And he had this, you know, this shelf where he painfully and with pride arranged his books and his encyclopedias and his dictionaries. We had this child dictionary, very colorful, very big, and then it had all the contained all the information that you can ever think of. And so one of these days we had visitors, our friends. So we brought down the book. It's a very colorful dictionary for kids. So as you're seeing very attractive, as you're seeing the words, you're seeing the pictorial explanation, and then you're seeing all the words, and then they will go to town explaining so many things. So we brought it out, and I guess in our play, one of the front got turned, some of the pages got turned, and my sister and I, we knew that we were done for, because it was just the two of us then. We didn't know how we were going. My mom was also she was also she wouldn't save you from my dad's. No, because I mean, and that is important, because parents have to be on the same page when they are disciplining kids. She was a very loving, she was emotionally present for us and all of that. But I knew that she also followed she didn't indulge. She was nurturing and caring, but when it was time to be reprimanded, you got reprimanded for it. So on that day, we couldn't also go and meet my mom because she was going to just match us to my dad. So we kept the book in waiting for the day it was going to happen. And someday it really did happen. So we just heard the thunderous call, my sister's name and myself, and we knew we were in trouble. So we marched there, and he asked us, "What happened to this book?" And of course, we were stammering. He doesn't really beat us. I can count the questions he's beating me, and all the time he's actually beating me was over books. I remember that day. I think we got spanked from his belt. The other time too, it was after I had finished in Queen's College. In QC, you buy all your books. They give you a list of all the books from the bookshop, and I stupidly handed it over to somebody. When I left GS2, I was moving to GS3. I stupidly handed over all my books, the textbooks from GS2. I didn't ask my dad for permission. I got beaten over that. So those are the two instances I can remember that my dad beat it, and it was over books.
Esteemed Dr. Kafayat shared her secondary school experience. She exhibited leadership qualities in school as she was a school prefect. She was active in extracurricular activities like drama society, presentations, and debates. She asserts that all these activities groomed her to be an outspoken personality.
You pass through the 4 walls of QC. QC has to pass through you. We went through a lot of rigors, debating, class presentations, and so many other things that will shape you to be who you are. I was also very active in the drama society. Sometimes we would even travel, leave Lagos to other places to go and present drama and all of that. So I guess all of those things shaped who I eventually became.
She also took us through her days in the university, where she had to choose between radiology and psychiatry. In 2009, She was opportune to do an internship at the Federal Neuropsychiatric Hospital, Yaba. This inspired her passion to major as a psychiatrist.
But by the time I was done in QC and was going to get into university, it was already, my mind was made up, I was going to study medicine. And alhamdulillah, I was able to get, medicine in University of Ilorin Teaching Hospital, at the, at the College of Medicine, University of Ilorin, where I spent about 6 years plus to study medicine. After which, I came back to Lagos for my 1-year internship with the Lagos State Health Service Commission. And at the expiration of that time was when I needed to make a decision on what I was going to do. So, but I had narrowed my choices down to either radiology. Radiology is, yes, exactly, investigation and diagnosis in medicine, and psychiatry. My 400 level posting in University of Ilorin in psychiatry, I found very interesting. I wanted to understand why people had emotional disorders. It was a strange setting when you see people hear voices other people in the room could not hear, where some would claim they were seeing things others couldn't. When you see depression, people attempting to harm themselves and possibly even kill themselves. So it was an eye-opener for me. And at that point, I also penned psychiatry as a possible area of specialization. At the end of my, internship in Lagos, I was privileged to be asked, where do you want to do your compulsory 1-year service? And I chose Yaba Psychiatry. And to God be the glory, I actually got posted at the end of camp. I got my letter to resume in Yaba Psychiatry. And that was my sojourn into psychiatry. And it's been the best thing that has ever happened to me.
Beautiful Dr. Kafayah shared her love story with her husband. They met in 2009 after internship, and they tied the knot in 2010. Their union is blessed with 2 kids.
I met my husband in 2009, just as I was running off from medical school. A friend of my older sister actually introduced us, and we got married in 2010, just as I was rounding up at Yaba Psychiatry. It's been a very, interesting union. I'm married to a very supportive, a very encouraging. He actually dropped me here for this interview. Most of my, speaking engagements, because I tend to do a lot of that these days, he takes me there himself, or he's just been a very wonderful and supportive person, someone that totally supports me in this journey that I have undertaken, because it's a lot. I get to go out a lot to talk. Religious organizations, schools, even in corporate organizations, I do a lot of that. And he's been very supportive. He's a very good man.
Being a devoted Muslim, she affirms that Islam has shaped her life in a positive way. She has found peace in Islam and strives to be perfect in her faith.
Even right from the early days, we already had that. We're already indoctrinated into Islam from the very early days. I wasn't, by the time I was done with my primary 6 or so, I was already saying my salah complete as early as primary 6, And I remember that salah is not even I don't consider it a chore. Like, it's just a part of my life right now. It's something I've been able to, imbibe as a part of me. Wherever I am at, when it's time for prayers, my mind is constantly telling me, I'm happy to be a Muslim. I'm not just a Muslim because I was born into it. I've found peace in Islam. My prayers have been accepted in Islam. It's a journey that has paid off for me and all of that. So it's home. So it's not about, maybe because your father put you on the path. I studied the Quran. I did my walima. So I understand the teachings of the Quran. I try to live my life as upright. There's nobody that is perfect, but I strive. I am a striving Muslima. That's what I tell myself.
Dr. Kafayah, who is currently a consultant psychiatrist, speaks a lot on mental health advocacy, as well as demystifying the misconceptions around mental health. Dr. Kafayah has also taken her mental health advocacy into the web space with the establishment of school mental and physical education online.
After Yaba Psychiatry, I spent 1 year there, and because I got all the basics of the training that I required. Shortly after that, I got into residency training at the Lagos University Teaching Hospital, where I recently rounded up my training in psychiatry. So currently, I'm a consultant psychiatrist, and that has been my life. Right now, I'm very much interested in psychiatry and advocacy for mental health. So I speak a lot for mental health. I talk about the symptoms of the disorders. I try to debunk all the myths around it. It's being a spiritual attack. It's being as a result of generational causes, or that is because it's a reward for wrongdoing. So those are the things that we are trying to correct. No, it's a medical, condition that targets the brain, the same way the eyes, the heart, the kidneys can be ill, the brain is also allowed to be ill.
As a practicing psychiatrist, she has this advice that emotional disorders are not spiritual attacks. Anyone that is affected can seek medical help.
More importantly is that everybody should realize that by virtue of being human beings, by virtue of being born, by virtue of still breathing, by virtue of having a brain in your head, you are at risk of having an emotional disorder. There is no immunity to this thing. That's the truth. It is not a respecter of age, of person, of class, of race, or gender, or social status. For as long as you're human and you have a brain, that's the truth. You can have an emotional disorder. And we really do not have control over the things that happen to us in life, because it is triggers, such things, life events, something bad that really bothers us, or even something good that really pleasures us. And these are three triggers for emotional disorders. So everybody has to be aware, and we just need to know that when you do not feel right, when it feels like you're unnecessarily overwhelmed or burdened, or you feel like you're not just yourself, we need to have a positive attitude towards seeking help and remove stigma of emotional disorders. If you need to go and see a therapist, a psychologist, a psychiatrist for you to be whole again, please do. Emotional disorders are not spiritual attacks, and not everybody who has an emotional disorder are going to end up on the streets. We have thousands of patients who do well and live good lives because they take medications and they continue in their life. Those on the street, the vagrants on the streets, those are the people who did not comply with medication use, or they just got tired of using, or family could not afford to care for them anymore. People who commit suicide is also a complication of the illness. It is when you do not take care of yourself or you do not get help immediately, the progression of the illness can get you to the point where you're at the lowest of the low, and then you can attempt suicide. So suicide is not a symptom of mental illness, because that is what it's beginning to look like. When people kill themselves now, they look at it like, oh, the person had an emotional illness, that's why they killed themselves. No, it is perfectly preventable as long as you get help, timely intervention.
For her inspiring and impactful life, modest contribution to mental health, and a spirit of advocacy, we celebrate Dr. Kafayah Ogunsola, Ní Balogun, as our icon of the week on The Guiding Lights.